Today I have my PT, Dr. Corey, training with me, doing our Olympic weightlifting training session, and we're gonna talk a little bit on my rehab. Recently, I had a knee surgery, so I'm doing some rehab, so come with us. Beautiful day, Fernando Sport Fitness Club at Reis Weightlifting Miami.
Pain in the overhead press position, I started getting a little pinch. So usually that's due to a supraspinatus impingement of the rotator cuff. It's one of the rotator cuff muscles that's responsible for lifting the arm overhead. So if you're in the overhead press position and it's pinching here, I just take one of these TRX bands, loop it around my legs. I put it just on the bulk of the deltoid. You want it to be off the bone a little bit. I take my other hand to apply some pressure, and then I just reach up, and it's like immediate relief of pain. And then I just do like 10 or 15 repetitions. You should feel the muscle working, but it shouldn't be painful.
Too sharp.
If you squeeze?
If I squeeze here, that's
Painful? Okay. Again, again. Better, worse, same?
Better.
How much better?
Much better.
Okay. And relax. And again.
Better.
And relax. And again. And relax.
You don't have, bro. You fucking like you're a magician, bro. You could just fucking magician.
I just need a hat.
You could just
Bring a hat for me next time.
So guys, today we had a Olympic weightlifting session with Dr. Corey. He was the one responsible for my knee. We've been recording. Hey, come over here. That's Isaac, his little son. Recovering process.
Yeah.
You being responsible for it.
For sure.
So he's been helping a lot. I had a little bit of issue with my hamstring, but he said that it's normal.
Yep, all of it's normal.
So what was the steps that we had? Like step number one, addressing the injury.
Sure. Yeah. So the post-op protocol was certain degrees of range of motion over a certain period of time. So for the first 2 weeks post-op, it was from full extension to 45 degrees of flexion. For the 2 weeks after that, so from weeks 2 to 4 post-op, it was from 45 to 90. And then the 2 weeks after that, so weeks 4 to 6, it was 0 to full range of motion. So one of the issues that typically come about with any type of operation or any other type of injury is a deficit in motor control. That just means how well that the body is able to perceive the movement patterns. So whenever you have an injury, there's the map in your brain. There's a map in your brain that pretty much determines where and how you should move, which muscles are to be used, what the joint range of motion should be at, how much strength you should use. So whenever you have surgery or an injury, that map is disturbed. So you pretty much have to redraw that map because it's very fuzzy. So one of the issues that Fernando was coming about was too much hamstring activation in the beginning, and then as he started to gain the range of motion, it started to reduce. In other words, if the hamstrings weren't able to perform the movement, some other body part would. So he was starting to pull from his back. He started to shift his weight to his right foot. So basically we worked a little bit on getting that hamstring to be working up a little bit more to reestablish that map in his brain, that motor control.
I really like what you said about map, because I was lost. I've never had, like, to be honest, I've never had such like a long break throughout my training career.
For sure.
So I had to, like, there was a break that I spent like 2 months without doing anything, just pretty much just rehab without doing Olympic weightlifting. And I like what you told me one day about like the map, that before I had a clear map. I know what I had to do to go to the competition. I know the steps that I would take for the training, my training method to get ready. And now everything is blurry, you know, everything like now I'm starting to connect again, starting to feel better again. So now I know the steps to be 100% back again. But I had to like readdress that in my mind and be ready for a completely different like training setup, I would say.
Yeah, one of the issues that often comes with athletes in particular that have spent a lifetime in their sport is really coming to terms with re-navigating that map and choosing a different direction, but still having that same goal. So, you know, throughout this whole process, the 3.5 months that I've been working with Fernando, little things would come up here and then. You know, either the ankle was getting a little fuzzy, or the hamstring wasn't working so much, or there's a little pain in the back of his knee, and it was just addressing the concerns as quickly as possible so that he could get back into the sport-specific movements, so that he could really solidify that map, that process of goal-oriented processes. Because, you know, like, you know, Fernando mentioned, he had a clear path of where it is that he had to go, you know, the sets, the rep, the time that he was spending every single day in, day out. And if you can't do that as an athlete, I know it's very frustrating.
That's true.
So even working with that aspect is very challenging. But, you know, Fernando, again, elite athletes are much easier to work with because they just dominate whatever it is that you set them out to
That's
to
true.
get.
It's been a good challenge so far. So I would say that we've been like 15 weeks after surgery.
Yeah, pretty much January 1st.
15 weeks to 16 weeks. So now I would say that today was the first day that I felt like back on track.
Awesome, man.
Back on track. Thank you so much for all the help, brother. Thank you,
sure.
my man. So if you guys have any questions about whatever it is, like about PT, recovery, Olympic weightlifting, you can send to us. We'll be more than welcome to answer those questions. Thank you very much, guys.
Have a good day.